in to provide her testimony. Thank you.
Hello, everybody. On March 18, 1951, 4 little girls were blessed with the birth of their baby brother. He was named William Anthony, but we just called him Billy. And oh, what a joy he brought to our lives. If one looked into his eyes, they would see the gentleness of his soul and the love in his heart. Billy had his first heart attack when he was 39. The doctors found he had an arrhythmia problem, and because of that, he was a candidate for an internal defibrillator. He had insurance at the time, so having his heart and his defibrillator taken care of wasn't a big problem. In December of 2003, the company Billy worked for closed, and there went his insurance. With his pre-existing heart condition, and insurance companies refused him coverage. December 14, 2007, Billy collapsed at work and was taken to the hospital via the ambulance. Once there, he was admitted to a cardiac unit. In the late morning, Billy's cardiologist came into the room and told him that he needed some heart studies done and that his defibrillator battery was very low and needed changed. He told Billy that it would all be done as an outpatient. When asked, the doctor said he would have to pay for the test up front and that he would need thousands. Billy said, "I'm a pizza delivery driver. I don't have that much money. I don't know what to do." The doctor asked, "William, do you put oil in your car?" Billy replied, "Of course I put oil in my car." The doctor asked, do you put the best oil money can buy so your car runs smoother and lasts longer?" "Well, that's what you have to do for your heart." Billy replied, "Doctor, you're talking about an $8.50 can of oil compared to a $10,000 defibrillator battery." At that point, the doctor pointed his finger at him and said, "If you get your priorities straightened out, you'll be able to come up with that money." The doctor walked out of the room, and Billy was discharged 2 hours later. Billy and us, his sisters, knew that short of a miracle, he would never again get medical care for his heart. Try living with that worry. On March 7, 2009, Billy left work for the day. He drove 2 blocks, came to a stop sign, put his car in park, and slumped into his steering wheel. The battles of his life were all over. As you know, Billy doesn't need me to fight for health care reform for him. He's doing what he did every day of his life. He is walking with his Lord, our Lord. I'm telling Billy's story to you and to anyone who will listen, because there's millions of Americans just like Billy, whose voices are not heard, whose faces are not seen, and whose pain, suffering, worry, and death are just case sera moments. We need healthcare reform with a public option, run by the government, guaranteeing without discrimination that any American who wants health insurance will be able to have health insurance. And that insurance has to be of high quality and affordable. Thank you for listening. God bless America and all of her people.